Have you ever wondered what the dengue fever is all about? Dengue fever is a fascinating yet dangerous illness. It's a mosquito-borne disease that thrives in tropical and subtropical regions across the globe. These tiny buzzing creatures carry the dengue virus in their bites, causing a host of symptoms in the humans they feed on. Dengue is more than just a simple fever, and its reach extends far beyond the confines of the mosquito-infested regions. Now, let's delve into the pathogenesis of dengue fever. Dengue fever starts with a bite, but not just any bite. It begins with the prick of an infected Aedes mosquito, a tiny vector with a powerful punch. As this mosquito feasts on human blood, it also delivers the dengue virus straight into our bloodstream. Once inside, the virus doesn't linger aimlessly. It targets our white blood cells, the very cells that are supposed to protect us from such invasions. This is where the real action happens. The virus infiltrates these cells, hijacks their machinery, and begins to replicate itself. Imagine a factory line of white blood cells, each being commandeered to produce more and more dengue viruses. This process of viral replication is like a silent explosion happening right under our noses, or rather inside our bodies. It's this rapid multiplication, this viral takeover of our cells, that triggers the onslaught of symptoms. This duplication is what leads to the onset of symptoms. So how do you know if you've contracted dengue fever? Well, the symptoms of this disease can be quite distinct. The onset is often sudden, marked by a high fever that can soar up to 40 degrees Celsius. This fever is typically accompanied by severe headaches, often described as being behind the eyes. Joint and muscle pain are also common, earning dengue the nickname breakbone fever. You might feel extremely fatigued, almost as if you've run a marathon without any training. Nausea and vomiting are other telltale signs, making it difficult to keep food and liquids down. A couple of days in, a skin rash may appear, reminiscent of measles. Some individuals might even experience mild bleeding, such as nosebleeds or gum bleeding. Remember, early detection is crucial. Dengue symptoms can be quite severe, but they're also the key to recognizing the disease. Knowing these symptoms is half the battle won. Now let's talk about how we can treat dengue fever. While there's no specific treatment for dengue, there are ways to manage the disease. Dengue fever, an illness caused by a viral infection, is a complex condition to deal with. The lack of a specific treatment can make it seem daunting, but don't despair. There are several strategies we can employ to manage the disease effectively. First and foremost, rest is crucial. The body needs energy to fight off the virus, and resting provides an opportunity for the body to recover. Alongside rest, ensuring ample fluid intake is key. Hydration helps combat dehydration caused by high fever and vomiting, common symptoms of dengue. Pain relievers with acetaminophen can also be used to alleviate symptoms like headaches and joint pain. However, it's important to avoid medicines with aspirin, as they can increase the risk of bleeding, a potential complication of dengue. Moreover, it's imperative to seek medical supervision. Regular monitoring by healthcare professionals can help detect severe forms of dengue early, and timely intervention can be a lifesaver. On a preventive note, a dengue vaccine does exist, but it's not a silver bullet. It's recommended only for individuals who have had a previous infection, as it can lead to severe dengue in those who have never been infected. This underlines the importance of mosquito control and personal protective measures. Remember, dengue is a serious illness, but with careful management, we can navigate through it. Effective management can significantly improve the patient's prognosis. Dengue fever, while a serious disease, can be effectively managed with early detection and proper care. We've journeyed through the intricate pathogenesis of this illness, understanding how the dengue virus, carried by the Aedes mosquito, invades the body, multiplies, and affects various organs. We've identified the telltale symptoms of dengue fever, ranging from high fever and severe headaches to muscle and joint pains, and even a characteristic skin rash. These signs should never be ignored, and immediate medical attention is crucial. We've also discovered the importance of proper treatment and management. There's no specific medicine to treat dengue fever yet, But with adequate rest, fluid intake, and medical supervision, patients can recover effectively. In severe cases, hospitalization may be necessary to manage complications. We've unraveled the mystery of dengue fever together. Remember, prevention is always better than cure. Stay safe and keep those mosquitoes at bay.